A woman who notices an involuntary loss of urine following a coughing episode is most likely experiencing which of the following types of incontinence? A. Urge incontinence. B. Overflow incontinence. C. Stress incontinence. D. Functional incontinence. And the correct answer is C. Stress incontinence. Unintentional loss of urine is called urine incontinence, whereas unintentional loss of stool is called fecal incontinence. Stress incontinence happens when physical movement or activity such as coughing, laughing, sneezing, running, or heavy lifting puts pressure on your bladder, causing you to leak urine. Remember that stress is not responsible for the leakage of urine in stress incontinence. Which of the following is a symptom of a urinary tract infection? UTI. A. Headache. B. Abdominal pain. C. Runny nose. D. Painful urination. And the correct answer is D. Painful urination. Painful urination is also called dysuria. Painful urination in UTIs is primarily caused by bacterial infection, leading to inflammation and irritation of the urinary tract. The sensitive tissues of the urethra and bladder become affected, causing a burning or stinging sensation during urination. Additionally, inflammation and irritation can stimulate nearby nerves, further intensifying the pain and discomfort. Prompt medical treatment with antibiotics is essential to clear the infection and alleviate the sensitivity and discomfort. Which of the following is a risk factor for developing cardiovascular disease? A. Regular exercise. B. Healthy diet. C. Smoking. D. Normal body weight. And the correct answer is C. Smoking. Regular exercise, following healthy diet and maintaining normal body weight will decrease the risk of cardiovascular diseases, whereas smoking increases the risk of cardiovascular diseases. Smoking damages the inner layer of blood vessels. This leads to the accumulation of fatty deposits. This is called atherosclerosis. Smoking increases blood pressure, decreases oxygen supply, increases heart rate, forms blood clots, and decreases the good cholesterol, that is HDL. All of these increases the risk of cardiovascular diseases. Hence, smoking is a risk factor for developing cardiovascular disease. Which of the following is the primary function of red blood cells? A. Carrying oxygen. B. Fighting infection. C. Producing antibodies. D. Filtering waste products. And the correct answer is A. Carrying oxygen. Carrying oxygen from lungs to different parts of the body is the function of red blood cells. And they again carry carbon dioxide from the tissues and organs back to the lungs for exhalation. A patient is receiving intravenous heparin therapy. Which laboratory test should the nurse monitor to evaluate the therapeutic effect of heparin? A. Prothrombin time. B. Activated partial thromboblastin time. C. International normalized ratio. D. Platelet count. And the correct answer is B. Activated partial thromboblastin time. APTT. APTT measures the time it takes for the blood to clot, and it reflects the effectiveness of heparin in preventing blood clot formation. By regularly checking APTT levels, nurses can adjust the heparin dosage to ensure it remains within target therapeutic range. This provides the necessary anticoagulation effect without causing excessive bleeding complications. What is the definition of inunction? A. The process of applying pressure to a wound for homeostasis. B. The act of rubbing or applying a substance onto the skin or mucous membranes. C. A technique used to deliver medications via inhalation. D. The process of injecting a substance directly into a blood vessel. And the correct answer is B. The act of rubbing or applying a substance onto the skin or mucous membranes. Inunction is a medical term that refers to the act of applying a medication or substance by rubbing or spreading it onto the skin. It involves the topical administration of a drug, usually in the form of an ointment, cream or oil. Stiffening of the body after death is called A. Livor mortis, B. Algor mortis, C. Postmortem, D. Rigor mortis. And the correct answer is D. Rigor mortis. The stiffening of muscles that occurs after death is called rigor mortis. How is hypermetropia typically corrected? A. Concave lenses, B. Convex lenses, C. Bifocal lenses, D. No correction needed. And the correct answer is B. Convex lenses. Concave lenses, bifocal lenses or no correction cannot adequately address the visual blurring caused by hypermetropia, whereas convex lenses are typically used to correct hypermetropia. Hypermetropia is a condition in which nearby objects appear blurry, while distant objects are clearer. The physical appearance known as buffalo torso is most commonly seen in which medical condition? A. Asthma, B. Diabetes, C. Cushing's syndrome, D. Hypothyroidism. And the correct answer is C. Cushing's syndrome. Buffalo torso is a physical feature seen in some people with a medical condition called Cushing's syndrome. It looks like a hump or extra fat on the upper back, shoulders and neck. This happens because of too much of a hormone called cortisol in the body, and it is one of the signs of Cushing's syndrome. Which organ is responsible for removing bilirubin from the bloodstream? A. Liver, B. Kidneys, C. Spleen, D. Pancreas. And the correct answer is drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.